I'll be telling the proteomics profile of vitreous in macular hole, more of a clinician perspective. So why we bother about proteomics? Proteomics is nothing but a full collection of proteins which are characterized in a very holistic manner at a given time in a tissue. So it is dynamic, it is a real-time process, and what we actually see, whatever imaging modality, is the top layer. But what we are now talking is a little below that, so that it's better. Genotype is the lowest, and then the starting of that we have proteins, the pathways, and all the proteins characterizing these proteins in a given tissue is proteomics. So what actually we understand by understanding these proteomics is that when a disease can occur, how the disease is progressing, what are the effects of treatment, and can we identify any new ways to treat the disease. There are very less publications based on proteomics for macular hole. There are many proteomics based studies in vitreous in many retinal diseases, and one of them is from Aravind Eye Institute, Dr. Sagnik. So macular hole doesn't seem to be just the biochemical change. There are a lot of biochemical changes happening, changes in proteomics, more of biomechanics playing a role. As we had seen in the earlier talks, the vitreous plays an important role. And Dr. Mahesh gave this question that what is predisposition? Which patients develop macular hole? We really don't know. And next couple of slides, I'll be showing the information which has been collected from these proteomics data, and we will try to answer these questions. So what are the predisposing factors when a macular hole can form? So if you look at this is a cross section of the retina, and the most stiff part of the retina is ILM. 50% of the tensile strength of the retina is because of internal limiting membrane. And one of the predisposing factor is that with aging there is increase in thickness and stiffness of ILM. And why that happens? Because there is some deposition of extracellular matrix proteins on the retinal side. The lower one is the retinal side. They get deposited, and that is one of the predisposing factor. One of the theory which in the first talk we heard is the vascular theory, is basically there are studies to show that there are elevated circulatory fibrinogen levels, and these fibrinogen probably are causing a decrease in the macular blood flow, which causes an involutional thinning, again one of the predisposing factor. There are also some genetic variants which have been found which are related to retinal thickness. An alteration in these genetic variants may cause retinal thinning, again one of the predisposing factor. And there are few epidemiological studies which have shown that there is hormonal imbalance after oophorectomy. The risk, especially in the UK population, they found this. So probably these are the risk factors or predisposing factors for macular hole. So what happens? Why macular hole forms? And as we know, it's mainly the vitreous. There are changes in the vitreous, and how those changes happen. There's a small animation which will show how the vitreous gets pulled, and that's the initial inciting event. So with aging, there is enzymatic degradation of hyaluronic acid. There is changes in the synthesis. There is turnover which gets altered, and there is overall reduction of hyaluronic acid concentration. Simultaneously, there is increase in collagen concentration because there is more breakdown of collagen type 9. There is aggregation of the collagen fibrils, and this actually causes weakening of the vitreoretinal interface, leading to a separation from internal limiting membrane. What remains in macular hole is that the posterior vitreous cortex, which remains adherent to the fovea, and this is because of certain adhesive molecules like fibronectin and laminin, which binds to the receptors on the posterior vitreous cortex, and they promote the adhesion. And there is this abnormally persistent vitrofoveal attachment of the perifoveal vitreous separation. Then what happens is that there is increase in the expression of fibrinogen, alpha and the gamma chains in the vitreous, and they start pulling. So there is increase in the AP traction. what is told, or what some studies have shown, that it's not only this fibrinogen, but there is a subtle anterior displacement of the vitreous cortex, and that causes the AP traction. So that's how the enteroposterior traction happens in a macular hole. Now let's see why a tangential traction happens. So let's go a little more deep. So these green cells are the Mueller cells, and there are now proteomics data suggesting that there is increased expression of complement factors. They cleave, they form more inflammatory mediators, there are conformational changes, there is activation of a protein called as alpha-2M, and that binds with LRP1, and that causes a Mueller cell to become activated. So now this Mueller cell, which is activated, it starts migrating from the intraretinal layers to the vitreal side of the ILM, and there they start depositing. There is another process which is called as proteostasis. It's a cellular process which ensures that there is a proper folding of protein, and that gets downregulated. The molecules which regulate this folding, they get downregulated, so they cause endoplasmic reticulum stress, and there is something called as a UPR, which is unfolded protein response, and that actually increases the cell survival. So these cells which migrate to the ILM, they survive more, they don't get autolyzed, and they start depositing there. There are certain proteins in ILM called as laminin, collagen, and many of these, they form a scaffold for the Mueller cell proliferation on the vitreal side. There's also upregulation of some more proteins like hyaluron binding protein, ECM remodeling factors, and they actually now transform these epithelial to mesenchymal cells, and there is this EMT, the epithelial mesenchymal transformation, and these mesenchymal cells, they contract. Why they contract? Because again, there is some proteins which are reduced, especially filamin A and vinculin, and they cause the actin cytoskeletal rearrangement. Just a minute. And this contracts the Mueller cells and causes a tangential traction. So finally, you have a AP traction, you have a tangential traction, and then it starts pulling. And when it starts pulling, there are Mueller cells which are normally in the foveal area. It is a Z-shaped manner, and this configuration gives the maximum stiffness to the Mueller cell, and the forces from vitreous don't go to the retina. However, when they get pulled, what happens is they become straight, and now the traction directly goes to the foveal cones, the foveal photoreceptors, and it starts lifting the Mueller cell cone. There is disinsertion of this cone from the underlying photoreceptors, and there is actually a schisis, and this foveal schisis is called as foveal cyst, and then gradually it pulls more, and now you have disruption of photoreceptors, disruption of RPE. Both ILM and ELM are breached, and now the RP pump, it gets disrupted. There are cystoid spaces which form around these the schisis cavity, and finally the vitreous gets pulled up and there is a macular hole. So what happens when we do a vitrectomy? Actually, it releases the traction, there is proliferation of glial cells, there is photoreceptor recovery, and by injecting a gas, it promotes this fluid reabsorption and closure of the hole. So can we prevent macular hole? The proteomics approach, looking at the pathway which I have explained, there are multiple ways, multiple molecules which can possibly have a role in prevention of macular hole. I'll not go in details. So finally, just to conclude, proteomics has definitely helped us understand more about macular hole. The disease which was thought to be only because of biomechanics, we know the multiple proteins, there are predisposing factors, and probably we can do something to prevent the formation of macular hole. Thank you very much. I would like to thank Viraj. He is my research scientist who made all these illustrations. Thank you.